Welcome back here at noon. While COVID cases remain relatively low here in Wisconsin, there is some concern that we could see an uptick this winter. Here to talk about several new developments in the pandemic is Dr. Jeff Pothof with UW Health. Doctor, thanks for being with us this afternoon. We want to start by asking about the recent increase in cases in Europe. What are the latest predictions for coronavirus heading into the winter here in the U.S.?
I think the best guess is that we could see an increase in COVID-19 cases here in the U.S. as we get into the cooler months. Throughout the pandemic, we've seen this pattern where cases will first start to increase in Europe. We're seeing an increase in France right now. Then over to the United Kingdom, they're also seeing that increase. And then we see it on the East Coast of the United States through the Midwest, then finally the West Coast. So I do think that we'll see an increased cases. It's a good sign that if you haven't gotten your vaccine or you're not boosted to where you need to be, getting that done now before we see that increase could help you when that happens.
And just to be clear, a new increase does not necessarily mean a new variant, correct?
No, right now there's a couple new variants that are out there. It's hard to say if any of them are going to become fairly significant. This is more a factor of as the months get colder, we start to gather inside more. We create a more lucrative environment for the virus to transmit because we're usually closer to other people in spaces that don't have as good a ventilation.
A recent study found that 4 out of 5 adults with long-haul COVID have problems with day-to-day activities. Can you explain this a little bit? What kind of problems are they having?
Yeah, so when you look at people who come down with long-haul COVID symptoms, it seems like it's causing disruptions in their life for an extended period of time. Some of these people are having difficult times concentrating. They're struggling at work, thinking through problems and things like that. Others are having problems with fatigue. They were physically active before they got COVID-19, and now, despite being months, sometimes years later, they're just not able to perform at the same physical level as they were in the past. And as you can imagine, 81% of folks with long-haul COVID are saying this. Really makes that point that, COVID isn't just about whether, you died or you lived from it, but these long-term complications from folks who have had COVID and then go on to get long COVID.
Let's talk about some new research that shows 90,000 lives could be saved if 80% of Americans got the latest booster shot. Can you explain that study a little? How many people have this booster shot right now?
Yeah, so right now we don't have great uptake of these latest boosters, and we have a lot of Americans who are not what we would call up to date on their vaccination, i.e. they may have gotten that original series, but they haven't kept up with the booster doses. Where this is particularly important, those who are a little bit older, age 50 and older, certainly over age 65, what we know is that boosters actually protect you against severe disease. They make it from COVID being an uncomfortable week at home to you being in the hospital and you potentially dying. When you look at the rate of people that are hospitalized, that die, and then who's actually boosted and who's not, you can come up with these numbers about how many lives getting your booster can save across the United States. So another argument to get your boosters updated before we get into this likely increased COVID season as the months get cooler and we all go inside.
Really quickly, because we're running out of time. You can't start with the booster shot though, right?
Right. So first you got to get that initial vaccine series, that 2-dose series. After that, you need to wait a few months and then you'd be eligible for a booster. If you're not vaccinated at all the more reason to get that done now before we see more cases this fall. All
right, Doctor, thanks so much for being with us this afternoon. And a reminder, you can always find the latest information on the coronavirus, including information about the latest booster shots at tmj4.com/coronavirus.